This next panel is going to be on health and family. I thought we're going to take a goodwill message from the Nigerian and Canadian Business Network. Maybe we'll wait for Lubenga later on to get that as a revert.
Yeah.
But there's supposed to be, am I right? There's supposed to be a goodwill message. Are we still taking it now? Otherwise, the moderator for this is none other than a foremost frontline medical icon, reference within the entrepreneurship of the medical industry here in the Federal Republic of Nigeria, Dr. Orade Doherty, founder, medical director, Ingress Health Partners, founder, African Children's Hospitals Foundation. Yes.
Yes.
It's going to. Am I right?
Go ahead. Go ahead. Go ahead, Dio.
I just want to know what is coming up next, and while I revert to the back end for that, so that we are not
a goodwill message, please, from Canada, Mr. Jackson. Mr. Jackson is on.
Okay, Jackson. Thank you very much.
Very good.
Welcoming NCBN Jackson Igbinosun. Welcome, our VP of the Nigerian and Canadian Business Network.
Yeah, welcome, Jackson.
Okay. Good afternoon, everyone.
Good afternoon.
Okay. Thank you, moderator, for the opportunity to do this remark on behalf of the Nigerian and Canadian Business Network. In a special way, I want to thank the organizers of this workshop and the team harnessing and facilitating Nigerian diaspora in national transformation. I also want to appreciate our distinguished panelists for lending time and expertise in enriching this all-important workshop. Nation building is the responsibility of citizens regardless of geographical location. As stakeholders to the Nigerian nation, I cannot overemphasize the imperative for the Nigerian diaspora professionals to work closely with governments, ministries, departments, and agencies, professional bodies, industry associations, as well as organized private sector in proffering long-term and sustainable solutions to those challenges that we daily grapple with as a nation. From food security, energy sufficiency, adequate healthcare for all, accessing funding to execute key infrastructure projects needed to unleash the nation's economic potential, exploring alternative and sustainable sources of revenue for running our economy, etc. As a nation of 200 million plus young, vibrant, and creative people, our conversation must consistently center around ways to develop our industrial base that will ultimately produce the much needed goods, not just for our local markets, but for the African continent and globally. A sure way to diversify from overdependence on revenue from crude oil. I want to commend the good work of the Presidential Enabling Business Environment Council, PBEC, which was set up in July 2016 by His Excellency, President Muhammadu Buhari, to remove bureaucratic constraints to doing business in Nigeria and make the country a progressively easier place to start and grow business. The work of PBEC is a prerequisite for transforming Nigeria into an industrialized nation. NCBN is a foremost diaspora organization in Canada comprising Nigerian, Canadian professionals and industry captives. As a professional group, we are consistently engaging with our Canadian counterparts, exploring options and innovative ways to grow and strengthen Canada-Nigeria economic cooperation by first identifying its prospects and possible barriers, and thereafter develop a framework to address the same. We are open to partnership and collaboration that align with human capacity development, research and development, job creation, economic growth, policy intervention, technical capacity, among others. I will be leaving my contact details in the chat box because we are open to collaboration from colleagues from all over the world, pursuant to the work of nation building. I want to thank everyone for the opportunity, and I wish you all a fruitful deliberation. Thank you, and I'm Jackson Osamede Binosun, Vice President, Greater Toronto Area, the Nigerian and Canadian Business Network, NCBN.
Thank you very much, Jackson. Dio, this is truly an amazing conference, bringing Nigerians from all over the world on one platform. And thank God for post-COVID, the use of the virtual space. So thank you, Jackson, and we look forward to more interactions with you and other members of your team in Canada. Thank you once more. God bless you.
Thank you so very much.
Okay, thank you, my dear. So Dio, we're moving over to the next panel. So we keep the momentum on. And if you permit me, I'd like to say that the next panel will be on health and family. And it will be the responsibility of the moderator of that panel, who is already here, Orode Doherty. Lovely smile, lovely smile. Lovely smile, you're welcome on board. So I'm just going to go right ahead and introduce you. And I hope you've been having fun all afternoon stroke evening right now. So without much ado, I'd like to say that she is the founder, medical director, Ingress Health Partners, founder, African Children's Hospitals Foundation. Dr. Orode Doherty is a US board certified pediatrician and public health physician and founder and medical director of Ingress Health Partners. Here she is working on expanding integrated comprehensive primary health care, employing a continuity of care model, incorporating anticipatory guidance and behavior change at community level, integrating this with technology and expanded partnerships to optimize outcomes. Now I'm hearing some language I've never heard before. Do you want me to confess, Doherty? But it's exciting to have you here, and I'm so looking forward to this panel. She's also the founder of the African Children's Hospitals Foundation, established with the aim of significantly expanding access to children across Africa to quality specialty care at designated dedicated pediatric centers throughout, I believe, Nigeria and Africa. Now, she received pediatric training at the Lagos University Teaching Hospital, which is very good to hear, and the Children's Hospital of Pittsburgh, where she was an award-winning pediatric resident and clinician. As pioneer pediatrician in ICAP, Columbia University, she led teams that established over 100 maternal and newborn care clinics for mothers living with HIV in several states in Nigeria, creating curricula for training health providers and tools for supervision. Until 2019, she was country director for Africa Nigeria, where she provided thoughtful leadership around enhancing the capacity of women and their families to improving health and livelihoods through behavior change, education, and enhanced access to resources and technology. At Africa, she worked extensively with youth programs, integrating sports and life skills. This is very good. Her 28-year professional career has spanned clinical and academic pediatrics, health and hospital system strengthening, community development, establishing livelihoods, and the promotion of life skills in women and young people. She's a fellow and moderator of the African Leadership Initiative West Africa and the Asian Global and the Aspen Global Leadership Network. She's also a moderator of the Kashim Ibrahim Fellowship Program in Nigeria, a fellowship for young Nigerians committed to public service. She holds a master's in public health, maternal and child health from Harvard University School of Public Health. Ladies and gentlemen, I present to you Orode Doherty. You have the table, sis.
Good afternoon, everybody. Thank you, Obinaya, for that extensive introduction. And I have the great pleasure of moderating this panel today, and I'm joined with three people whom I have a lot of respect for them individually, as well as for the work that they do in and outside of Nigeria. And so it's my distinct pleasure to introduce, in no particular order, but I'll introduce the lady who's my girl first, Dr. Nneka Mobison, Dr. Aham Onyike, and Dr. Chris Agbo. And I'm going to ask each of you to please introduce yourselves, be as elaborate as you desire. Please also talk about whatever it is that you consider to be your burning platform as it concerns this topic. So take it away. Let's go. So I'll start with Chris. I see you smiling, almost. But I don't see you here. Who's putting up?
Ladies first.
Excellent.
I'm here. Can you see me?
I don't see your picture. I see a blank screen. Is that me? Does everybody else see Chris?
I'm on.
Great.
Yeah, I'm on. Can you see
Okay.
me?
Yes.
Yeah.
Will you do
Thank you very much.
Yes. Thank you. Go ahead.
Can I go on now?
Yes, please.
Good evening, already, and good evening, everyone. It's a pleasure to be with you all this evening, and I want to thank the organizers of this program for such a fantastic platform for us to discuss a way forward in Nigeria. I'm Chris Abu by name. I'm a consultant nephrologist. I work at Hitchinbrook Hospital, Northwest Anglia Foundation Trust, NHS, and I'm a clinical lead acute kidney injury services and also simulation lead of the hospital. I'm a fellow of the Academy of Medical Educators in the United Kingdom, and I'm very passionate about medical education, which I have a broad experience in the UK. And I've had a lot of educational activities done in Nigeria over the last 10 years. My area of research is more into acute kidney injury and medical simulation. And an organization which is association across as a secretary the past 3. And for us in Mansac and as an individual, I've always had this passion. Having trained in Nigeria, did my
Chris, I'm losing you, and I'm not sure if that's just me or.
Yeah, we can't hear him.
Okay, so we lost Chris. What we're going to do now, Aham, if you don't mind, kindly introduce yourself. When Chris comes back on, it may be easier for him to switch off his video. I'm not sure. Okay, go ahead, Aham.
Can you hear me?
Yeah.
Okay. I'll say good afternoon to everybody. I want to say thank you to the organizers of this platform. Applaud everybody who has been involved in putting this together. I think we would all agree you almost across the board unanimously that national transformation is what we need. And so conversations pertaining to that are so apt, perhaps more so now than ever before. I'll circle back to that, but first let me introduce myself. So I am Aham Onyike, a doctor, orthopedic surgeon. Start with a family, I'm a father of 2, husband of 1. Almost messed that up and said father of 1, husband of 2, but I'm a father of 2, husband of 1. I consider myself a very lucky man. And I say that because I was born in the United States, in Colorado, to parents who at the time were in graduate school in the early 70s. And that has afforded me a lot of opportunity just from that birthright. But I'm also lucky because I grew up in Nigeria, which connected me to my roots. So my family moved back to Nigeria when I was 3 years old, and that's where I spent my formative years. Subsequently came back to the United States after secondary school when I was 17 and went to university, Penn State University, and then subsequently University of Pennsylvania, Rutgers University for medical school, and then Howard University for my residency in orthopedic surgery. So I am American trained, which again is a lucky blessing. I really did not want to come to Nigeria. It was forced on me at the time in the late 80s when it wasn't necessarily the popular choice to do that. But my parents were starting to see some glimpses of a downward trajectory in the educational system in Nigeria at the time. And and really forced me against my will to come to the US. But it was probably one of the best things that happened to me professionally. So I was trained in the US, I ended up gravitating to orthopedic surgery, which is my current profession. I am a joint replacement surgeon. I replace hips and knees, including the complex ones that require revision surgery. I'm also a trauma surgeon, got a lot of experience treating orthopedic fractures from trauma, including gunshot wounds, which are very unfortunately common in the United States in the early 90s and less so now, but still disproportionate to other populations. I currently live in Washington, D.C., and I'm, again, lucky. I practice in 2 countries. So I have a practice here in Washington, D.C., as well as in Maryland. And I also practice in Nigeria. I'm there frequently. I have 2 hospitals, small hospitals, named the Center for Advanced Specialty Surgery. One branch is in Lagos, and the other is in Owerri. My family is split. Both parents are in Owerri. That's where we grew up, partly in Enugu, but mostly in Owerri. And then I also have 2 siblings, one in Abuja and one in Lagos, and 2 other siblings here in the US, one in Virginia and the other in Baltimore. I am a founding partner of the hospitals in Nigeria. I am also the chapter chair of AiMP, DC, Maryland, Virginia branch. AiMP is the Association of Nigerian Physicians in America, which is the umbrella organization, the biggest umbrella organization for Nigerians here in the US. I consider myself a passionate Nigerian, and as such, I am an active participant in the Organization for Impact and Reform, which is a group of outsiders who started to see a need for involvement in the political landscape and are organizing to see what possible role we can have to make an impact, recognizing that our country seems to be unfortunately heading in the wrong direction. I personally have seen transformative change in Nigeria, and I guess this discussion today is about transformative change, but I regret to say that that transformation has been retrogressive, not progressive. I moved back to Nigeria in the early 70s, and at that time, security was less of an issue. The public health space was thriving. University of Ibadan was doing kidney transplants. University of Nigeria Teaching Hospital Enugu was a place to go in the East for very advanced care. Nigerian students were competitive with their peers anywhere in the world. You could travel anywhere in the country at night. Our athletes were thriving. The domestic league was thriving in football and sports. So somehow we've got into a trajectory where the 70s were better than the 80s, 80s were better than 90s, 90s, and so on and so forth. So I've seen transformation, but unfortunately it's transformation the wrong way. So I'm happy to be part of a discussion that hopes to find transformation in a different direction, especially in the healthcare space, because I think healthcare is a very useful measuring tool or yardstick to measure progress in any society. So if as a country, as a population, we are able to achieve transformational change in the healthcare space, I think that will indicate that we are transforming in the right direction in other sectors. Once again, it's a pleasure to be part of this panel. I commend the organizers, and I'm happy to put in my own 2 kobo into the discussion. Thanks again.
Thank you very much, Aham. So Aham has definitely roped in the conversation nicely with introducing himself both as a professional and as a family person. And this is really important because, you know, we're talking about family and health, and we tend to talk a lot about healthcare because we are professionals and this is what we do when we come together. But thank you very much for reminding us this is truly a panel about national transformation, about specifically the harnessing the role of the diaspora in national transformation. And that's really important because if we're going to be transformed ourselves, then we have to be, if we're going to transform our nation, we're going to have to transform ourselves. And the basic unit of transformation is really self and the family. With that, I'd like to welcome Nneka Movison. Dr. Nneka Movison, please introduce yourself and tell us about your burning platform as you tell us also about all the other lovely things about you.
Thank you so much, Dr. Orede, and thank you so much to the organizing the organizers of this amazing conference. It's such a pleasure to be with you all today with my amazing panelists and just to talk about what I think most Nigerians around the world talk about on a daily basis, whether it's on our WhatsApp platforms or with our family members or our friends. As Nigerians, I think we talk a lot, and it's exciting to talk about what we can do or what's already happening on the ground as well. So I'm going to follow Dr. Onyike's. I love how you framed your background, because I think, honestly, to Dr. Orade's point, that's where it sits. It's about the family. So I also was born in the US and then moved to Enugu when I was 6 and grew up there. And that was the best decision that my parents made, hands down. My father helped to set up the first science and technology university in Nigeria. It was then led by Professor Kenneth Dike, then Asutech, now ASUT. And he always told us that the only way that we were going to transform Nigeria and Africa was by technology. And so he told us we all had to be engineers, and we all had to focus on our country once we became engineers. And so literally my whole life, that's all I was told. And the reality is I became an engineer. So after going to University Primary School in Enugu, I'm highlighting this intentionally, and Federal Government College Enugu, I then went to MIT to do mechanical engineering, and then went ahead and did a master's in public health and a medical degree and an MBA as well. And it was all because I wanted to come back. And I'll be frank, it wasn't about Nigeria. It was about the continent. And I do think, as much as we think about Nigeria, we need to rest it in Africa, right? Because without thinking about regionalization in the continent, we're going to lose the power of power, the collective power of us. Anyway, so essentially, I decided after engineering, it was time to essentially, it wasn't my passion. I was passionate really about medicine. And I remember my father said, okay, the men in the family can be engineers, the women can be doctors. Not sure about that gender bias. Hopefully we don't have that anymore. But he supported me. But everything changed for me when my father had a massive stroke at the age of 53. Now, to just set some further context, my father built the first commercialized personal computer system in Black Africa. So what does that mean? He was working with his students at ASUT to really change the technology landscape for our country. And unfortunately, his dreams, the dreams of his students, got curtailed the day he had that massive stroke and didn't receive the right kind of care. So let's take a step back. He didn't have the support from a preventive and primary care standpoint to help him manage his uncontrolled hypertension. It was driven by massive stress, the massive stress of trying to build a legacy in technology that was going to change our system. Fortunately for us, we were able to evacuate him medically to the US, where when the physicians saw him at the Massachusetts General Hospital, for those of you who know systems in the US, they said it was a miracle that he was still alive. The rest of his life was nothing compared to what it had been before the stroke. It was marred by paralysis, mental health issues related to the stroke, and ultimately he died from complications from that stroke. That's completely what has fueled everything that I do today. So I run MDoc. I co-founded it with my husband, Imo Etuk. MDoc is a digital health social enterprise that leverages technology, quality improvement methodologies, behavioral science, as well as data to optimize the end-to-end self-care experience. So I'm highlighting self-care for people living with chronic health needs in sub-Saharan Africa. We're headquartered in Lagos. I'm actually based in South Africa. And today we have over 25,000 people on our digital platform, supporting them on the 99% of the time that they're out of a healthcare facility, really focusing on the lifestyle modifications that they can make to reduce the premature mortality, the preventable mortality that we're seeing from chronic disease. So that's my burning platform. My burning platform is my father's story wasn't unique then. It's happening every day today. It hasn't changed. Our primary, I think about you know, the then great Professor Olukoya Ransom Kuti, who was driving primary care and trying to drive primary care transformation back then, have there been the changes that he wanted and he envisioned in our country today? Not yet. So I'm part of, I think, so many diaspora that are working collectively to create a new Nigeria, a new Africa for our children and many generations to follow us. And it's a pleasure to be with you all today.
Great, Nneka. Nneka's story reminds me of why we do what we do, which is really ensure that systems work for all the people in order that those who require throughputing to the other important parts of healthcare systems, i.e. secondary and tertiary healthcare, get there on time and in good enough time to make sure that their outcomes are good. So it's great when you have a system where if someone recognizes that he or she has high blood pressure, that individual can very quickly be managed and taught to self-manage and identify issues well before they become what we have to refer to secondary and tertiary, almost doing ourselves out of a job, but at the same time ensuring that those people in the secondary and tertiary care get all the care that they need and they do not have outcomes that become a drain on themselves and their family members. This thing is, you know, this is everything that we are and that we're doing. So Dr. Chris Agbo, if you're there, I wonder if you want to wrap up your intro or if you want us to carry on, because I don't see you, but I don't know. I think that's because your video is not on.
Can you hear me now?
Yes, we can hear you. Thanks.
So I did my medical training in Nigeria. So I did my medical training in Nigeria and then subsequently did my postgraduate training in Nigeria as well before moving to the United Kingdom 18 years ago. And I also had to retrain and then finally became a specialist. And over the last decade or so, I've been involved in a lot of skill transfer in terms of how can we actually, some of the skills that we acquired abroad, how can we use it to impact knowledge and skills within our community in Nigeria. And that has been my passion, and I've started more or less individual. So I started with more or less individual projects, which was training mostly healthcare professionals. Started that in the early 2011 and 12. After that, I became involved in the national body in the UK, which is the Medical Association of Nigerians across Great Britain. A lot of activity, medical missions, training, and on an individual level, I've also been involved in, I'm very passionate about medical education. And I've done a lot of training for health education over the most specifically use of simulation in medical education. And these are some of the passions I've had over time. And we've continued to collaborate with some of the centers in Nigeria to see how we can use those to improve the quality of care we deliver to our patients, you deliver to our, can you hear me?
Yep.
Can you hear me still?
Yes.
Okay, I can see. So those are some of my passion, and as an association, we've been involved in a lot of medical missions, skills transfer program. We've been working other Diaspora Association, CAMPAD, and also with the Federal Ministry of Health to see how we can come together as a body and improve the quality care delivered in Nigeria through the Diaspora activities. So I think I'll stop for now and we'll proceed with the questions. Sorry about the internet connection.
No problem. We understand. We know where you are. Welcome. So I think I'd like to start off by just asking each of you to tell us sort of from your own from your own sort of where you sit, in what areas have healthcare practitioners in the diaspora now been able to make a dent or some significant change in the healthcare space in Nigeria? If we can each take 2 minutes, because I'd like to get us into the sort of deeper end of the conversation. So Aham.
Sure, thanks, Orode. Chris, sorry to see you going through this frustration with the connectivity. I hope it improves. I wonder if it's your MTN or your Glow line that's doing it. But anyway, to answer the question, how can the diaspora make a dent, or maybe how has the diaspora, if it has, made a dent? I think there's certainly been a lot of tremendous work by individuals as well as professional organizations to elevate the healthcare space in Nigeria. And this includes AiMP, which I'm part of, and the British equivalent, NAMSAC, which Chris, I believe, is part of, as well as many other organizations, including nursing associations, physical therapy associations, pharmacists, all doing things sometimes in their own small silos, sometimes with a bigger platform. Tremendous work, a lot of sacrifice, a lot of individual financial contributions in pretty much all aspects, the government sector, the private sector. And I myself, as I mentioned earlier, have put in significant investments and time and other resources into 2 hospital centers in Nigeria. And I know many others have done that, in some cases at an even bigger scale. There are also philanthropists who donated to build wings of hospitals, to buy equipment, to pay for training for individual people in the healthcare space. There's also transfer of skill models, and I've been involved in that, teaching hip and knee replacement surgery to different programs. I've done it at Ibobi, I've done it at Orthopedic Enugu, I've done it in Kanu, at Imo State University Teaching Hospital, Federal Medical Center, where, and on and on. So I think there's a lot that many people in the diaspora have done. But I think, unfortunately, at the end of the day, I'll draw the conclusion that makes me question if we've really made a dent. I think the problem is just so vast. The needs are so great. The world is moving on so quickly, and solutions that make sense in 2021, for instance, if it takes us 5 years to deploy them, become too late. The world has already moved on beyond that. So I think my long and short conclusion is that in spite of all our greatest efforts, I'm not sure we've made a sufficient dent, because our president just went to the UK for a basic medical checkup a month ago. What other country in the world does the president leave the country to go for checkups? And that, to me, sums it all up, that in spite of our best efforts, we are not quite delivered. I don't want to discredit the tremendous efforts that individuals and organizations have made, but I think we are failing to make a dent. And that's my conclusion on that.
I hear you. Neka, go ahead.
Yeah, I mean, we're not making a dent. I think, we have the best of intentions. We're working hard. There's so many diaspora outside, across the world who are trying. There are many who want to do something, but don't really have a clear conduit around how. So I do think we need to think about that too, around how we create the bridges that make it easy for them. But we're not making a dent. So if we look at it, so just, to build on what Dr. Aham has already said, the providers, there's a lot. Primary care, Dr. Orode, you're a complete example of this, right? Completely transforming primary care with nursing-led care. That's a true example of innovation. There's many examples, as Dr. Aham has highlighted, around specialty care, cancer care, oncology care, surgical specialties. So we're seeing that across the country, which is really exciting. On the payer side, right now everyone, only 5% of the country is insured, right? So when we think about coverage and we think about medical care, we have to think about who's paying for it. And primarily, as we all know, it's still out of pocket, or people in the diaspora also supporting families at home to cover their medical costs. So there's a lot of innovation happening on the payer front by Diaspora. Reliance HMO is an example of one. There's also the same thing on pharma side. There's digital pharma, many examples of amazing digital pharmacies that are doing great work for the country. On the NGO and social enterprise side, both Orade and I, have social enterprises, and there are so many else out there. There's a lot of NGOs, HSCF, HLA, there's a lot of NGOs out, African Children's Hospitals Foundation, that are really trying to drive transformation. And, as I think about it, the question is also, how do we disseminate the information about all the work that we're doing? So there's kind of a more collective push and an opportunity to highlight collaboration opportunities more clearly. Tech is growing like crazy. Health tech is huge. Right now, COVID has pushed it forward. And for folks like us who have been in this for years, it's the one positive thing from COVID has been to upend the notion that digital cannot work for health in Nigeria and Africa. Financing, so a lot of VC funds, private equity, there's a lot on the Diaspora are doing around that as well. So I would say that I want to underscore there's a lot happening and we need to celebrate it, because it underscores that there's opportunity. And I think that the environment has allowed many of us to come back and drive whatever we can do, whether it's small elements that ultimately will lead to transformation. We're all doing that. So as difficult and as challenging it is, I do want to recognize that fortunately we do have an environment that enables us to do that. Now, does it mean that we're making progress? On many days we don't feel like we are, even though we see individual progress. But we're going to get there. And hopefully we'll talk about a little bit later about what it's going to take to drive that collective transformation. But I'll say nano-dents are happening right now. We'll see the impact, or maybe our kids will see the impact in years to come.
So thank you, AiMP and Nneka. So Nneka, you started to talk about the things that are happening. And in many of these areas, you talked about some of what's probably happening quite locally, even though there are, maybe there are some diasporans. Where are the further opportunities that we can see or imagine for the diaspora? Because you see, one of the things that we can do is if we think about the already shining lights, we can start to coalesce them. So where are the opportunities? Where do you see us? What's going to drive us from where we are today to making a dent, from nano dent to dent?
So I will say, and it may not be the most popular answer here, but every single day I'm reminded of this. 95% of my team, right? 90% of my team is based in Nigeria. And we've completely changed our recruiting processes. I've had many a night talking to Orade and other close friends about what has made me really upset, to be honest with you, really sad. And the reason why I highlighted my primary school and my secondary school is because honestly, that's where it starts. So as many, as I think automatically medical professionals, we automatically think, okay, now we want to just invest straight into health. And I wanna actually put out a call for diasporans to actually take a step back. We need to reinvest in our education system. I think, AiMP and Chris have both highlighted the notion, or AiMP talked about the fact, we're not going to be able to play catch up. We're not going to be able to compete on the global stage. We're not able right now to compete on the global stage in most areas, right? If you look at where we are to date, our diaspora are doing excellent. Under Biden's administration in the US, look at how many Nigerians are, at the top, right? I mean, if you really even look at all that's going on in the tech space as an example, et cetera, in the US, in health, Nigerians, right? Or other Africans. So, we're an incredibly gifted people who have historically a strong work ethic, but if we don't invest in transformation in our education systems, our primary care and our secondary school and our universities, and then our clinical education, I don't know how much, I truly don't know if we're going to be able to see a change from that nanodent to macrodent that can change and create a new health narrative for Nigeria.
Thank you, Neka. You know, so Neka has brought in a very interesting thing, because you see, it's very easy for us to focus on health and healthcare and the hospital and the clinic and the clinical setting. But there are social determinants of health that we almost never address. And because we haven't addressed those, and the things that make for good healthcare, the things that allow for ongoing continuity of good healthcare and good healthcare practices, we keep falling flat on our faces. And the really important thing you've talked about here is one of the major things that determines sort of the state of human development is elementary education, secondary education. That's what leads to the young men and women who go into the healthcare space. And so my question then, and I want any one of you to please, because I want to sort of push ahead.
Sorry, I just came back online now. I think I'm
welcome.
So can I just
yeah. You want to take us back to the question that Neka answered?
No, just because I was cut off because of the network, if you don't mind.
Sure. But I wanted to take us forward, and maybe you can take us forward there.
Okay.
How then can, because it sounds like we're not just saying there are opportunities that we can see for the diaspora, but very importantly, there are some areas where if we don't fix them, there are going to be issues around our even trying to build a healthcare system. How might we as diasporans then begin to influence how government looks at these things and how they begin to prioritize and or shape the policies that could drive these determinants? So not just healthcare now, but all the other things that could make an impact on healthcare. Where are the opportunities by diasporans? Chris, you may start if you wish to, or rope that into the answer you're going to give us.
Okay, so sorry for the earlier disconnection. There are quite a number of things that the diaspora has been doing in terms of the healthcare space, both at the individual level. A lot of people have actually been doing a lot of stuff in the communities, and then also private sector collaboration. There's increased amounts of private sector collaboration. The diasporans are coming together, setting up centers in Nigeria and doing a lot of high-powered health services, which is very commendable. And that individual diasporan association has been contributing in one way or the other, which Mansa Gampas, they've all been doing that in different shapes and form. But most recently, the federal government has also been so involved with all the diasporan association, and there was a platform that brought all the diasporan group together, so we can see how we can come together and actually build a stronger force and see how we can improve the quality of care delivered to the nation, which is one of the things which is the Diaspora Healthcare Initiative that was started about 5-6 years ago under AiMP Dabere, and things seem to have progressed since then. And those are some of the areas that we're looking in terms of development. The opportunities are quite enormous in terms of what can the diasporans do. We have a lot of Nigerians in the United Kingdom, for instance, both the third generation, those ones that never grew up in Nigeria, but are willing to come back to Nigeria to see how they can also contribute. And it's all about putting health together and seeing how we can actually develop the healthcare system. And one of the areas we are looking at is actually more of skills transfer, education, because most often than not, what we are looking at is not just the funding. The funding might be there. Nigeria is so blessed with both natural and financial resources, and I don't think in particular funding is the issue. I think it's more of prioritizing our funds. And if we prioritize our fund, we can actually deliver. We're in a position to actually bring out the best of health facilities in the nation. But I think because of the misprioritizing the healthcare setting, and this is one of the areas that the stakeholders need to come into play, because once the stakeholders are involved in this, whatever input the diasporans are making will also have a greater impact. So it's a two-way way, because we are doing more of a brain drain now. We did a brain drain in the last 20, 30 years ago. Now there's more focus on brain gain. All the diasporans, expertise and all that, we are willing to come back to Nigeria and see how we can contribute collectively and create a better healthcare space. So those are some of the areas in terms of government involvement, individual involvement, private sector collaboration. The private sector, they have a role to play in this whole transformation, because over time, from experience, I've seen quite a lot of private sectors doing exceptionally well, delivering high-powered, high-quality care in the country. So it's time for us to actually embrace the role of private healthcare sectors to help us in this transformation, where most over the last 5-10 years, we've been focusing more on public sectors in terms of the transformation. But I think the time has come for us to also look at the private sectors. What role are they playing? How can we encourage, empower them, and also use them as a platform to increase the transformation that we so much desire?
Thank you, Chris. So, Chris, you made a few interesting points, and I'm going to rope those into the conversation that's going on the chat. Somebody has mentioned, Nina Brick says, thank you, Neka. Very true. Our educational levels of primary, secondary, and tertiary levels of education are deeply overdue for a hard reset. And I think that's, we're saying very similar things here, that there's need for a seismic shift. There's need for a hard reset. There's need for something major, a major overhaul. Someone's agreeing that you can't fix health unless you fix the social determinants of health. Onyemechi, thank you. We mentioned that earlier. And EMCIN has shared with us some of the information about the Lagos State Health Management Agency Coverage Program, which is Lagos State's approach to ensuring that every Lagosian has access to primary, secondary, and tertiary health care at an affordable, significantly reduced rate. Of course, you may want to think about what the payer, the providers of healthcare services think about what those rates would be. But it makes sense if you have a very large pool, and you can certainly significantly drive down the risk, and maybe you'll be able to ensure that you can provide services. Fatima Lawson also says, general average Nigerian has strong work ethic. What's lacking is the same level of ethics and dedication among leaders. What can we do from our platform to improve the healthcare system to a point where we make a dent? And I think that's the question we're all asking today. If we think about this Diaspora Health Commission, Abike Dabiri was actually on the call a little earlier, and I had hoped that she would be present, because it would have been a good thing to just ask her in to say, what have you achieved so far? 5 or 6 years with a diaspora as active and as wild as our diaspora, each of them moving the needle on a lot of things. You wonder how come we haven't started to feel that, in a big way. But I hear you about the skills transfer. And I think this is where the question was originally. How do we influence government policies? Government is certainly already clearly open to the private sector. A lot of the policies that government is putting out has to do with private sector ownership or management of some of the healthcare sector, because the jury is out. We know that 60 to 70% of healthcare in Nigeria is provided for by private sector players, and over 70% of healthcare is paid for out of pocket. So clearly the private space is yet to be harnessed. The question is, how can the diaspora do this? So there's an argument for a seismic shift. There's an argument for a hard reset. There's an argument for something major. Otherwise, we'll keep trundling along and we won't quite get there. And I worry even our grandchildren won't see this NECA. Aham, how can the diaspora help to inspire or achieve a seismic shift?
Wow, I'm not sure there's a panacea singular answer for that, but already I think that is spot on in terms of what most of us would agree that is needed at this time is some seismic shift. You can call it transformation. You could say overhaul, probably multiple synonyms that could say the same thing. I think if you talk to people, I just turned 50 earlier this month, and I have colleagues who are in their 60s and 70s, and some of them, thank you. Some of them have had conversations like this 15 years ago, 20 years ago. Some others had conversations like this in the 70s. If we're not careful, our children will be having conversations like this. So I think at some point we have to figure out and accept that a seismic shift is needed. And healthcare is just one facet of it. I think it's a big component of what Nigeria needs, but it goes beyond healthcare. You could say the same thing about security. You say the same about unemployment, about infrastructure, about education. So at the end of the day, I think as Nigerians, both those of us in the diaspora and those of us at home, probably have to come to the conclusion that we need to really have a seismic shift in the direction that our country is going, a U-turn in a whole new direction. Some other countries have been able to achieve that. Again, we're talking about healthcare, but I think that recognition is what's needed. I think the diaspora has a tremendous role to play for a number of reasons. I think, for one, there's an exposure that people have in the diaspora that gives a broad perspective. I think you can see a problem from a distance. You can see a society or a community from a distance, and you see it a different way than you would when you're there. And so, for instance, there's so much talk that's so frustrating now about fragmenting Nigeria into different ethnic groups, different new countries. And I'm not sure that's the answer. I think when you're in the diaspora, you can see that we have more in common than we have apart. You can see that we can even figure out ways to have alliances with Cameroon and Benin and Togo and Niger, rather than breaking up into small countries again. I think you can see that the problems that are pulling us down affect all of us, whether you're in Sokoto or you're in Calabar or in Olo or in Akure. So I think the diaspora has that advantage of being able to be exposed to a more global perspective. Not to say that Nigerians don't have it, but I think there's some advantage there. I think secondly, as it currently stands, the diaspora has an economic advantage. I think the earning capacity of people in the diaspora is huge. As we have seen in the last 5 years, remittances from the diaspora have actually surpassed oil revenue. So the current mentality, thinking, planning in Nigeria is all around oil revenue. And we now recognize that the diaspora actually has the financial might to compete with that. And if properly harnessed and targeted in the right direction, could unlock the real true potential that we have. Like I mentioned, the Biden cabinet, 5 young Nigerians. That's really just a tip of the iceberg. Almost every community I go, I see Nigerians excelling. I just finished a Zoom forum earlier today where we had Nigerians excelling in consulting, in politics, in hospital administration, and pharmaceutical and research. So how, as a people, as a country, do we have these massive problems? And we have a system where we are not quite able to put people who have the talent to solve those problems in position to solve them. And I think that's where the seismic shift is then needed, is that as a society, both in the diaspora and at home, we start thinking about this politically. I think primary care, tertiary care, education is really just too small at this point. I think our solution is political. That's where seismic shift can potentially come, in my opinion. I'll stop there. Thank you.
Wow. So Aham has taken us to the lion's den. We are now talking, we're back to where we started from. It's politics. The answer is political, and as the diaspora, we have a very unique way of seeing Nigeria, where we see Nigeria and Nigerians as one. And I'll tell you, when you have a group of Nigerians in any city or state in the US or in the UK, any county or region, nobody knows whether you're Igbo or Yoruba or you're Nupe or you're Kanuri. All we know is you're Nigerian. They look at you, you got look in your eye, you're a Nigerian, this is one of my people, moving right along. You raise your children together. And it's only when you hit Murtala Mohammed Airport that you start knowing whether you're from this part of the country or whether you're from above or below the Niger. So I agree with you, Aham. It's much easier to see Nigeria as a whole when you're outside, and to bring that back into the conversation time and again is a really important role of the diaspora. And I think that the Diaspora Health Initiative will be that's a really good place to infuse that in. Akin Ogungadero is saying on our chat, that they have a platform that allows Nigerians in the diaspora to compare and purchase healthcare insurance plans for their loved ones at home, or the ability for donors to provide such coverage for a group. And he gives the simplehealthcare.com. Plans are added as we continue to. He didn't finish that. But I note that it's interesting because Yemisi Ayeni had said earlier that Lagos State is looking for people who will support care for families and sponsors. So maybe simple, Mr. Ogunbadero, maybe you can start to have a conversation. They have two names in there, all wrote to me at lashman@lagosstates.gov.ng. And Dr. Zamba's email is also there as well. And she's the MD, and Mr. Rotimi Olatunji is the head of business development. So hopefully this is also a useful opportunity for people to come together and for AiMP to be a good convening platform. So Fola agrees with you, politics is the answer. If we're not at the table, we're on the menu, we have to engage. I could not agree with you more. Now, if politics does trump everything, how do you think that diasporans can then begin to fix our politics? Now, let me tell you, we have issues. You know, healthcare in Nigeria, we already have politics within the healthcare space, and then we have Nigerian politics. And I don't think one is divorced from the other. But who thinks they'd like to take on that question? And where do you think we would be able to make a dent in fixing the politics in Nigeria? I see Chris smiling, and so I'm just going to let you take it away.
Wow, I think there's the question is, are we in a position to actually fix the politics in Nigeria? I'll leave us to ponder on that. But one of the things I've looked at is the politics and healthcare system. They go hand in hand. And I'm going to look at it from different perspectives. Firstly, I'm going to look at the systemic politics, which we are talking about the government, because we have to have a buyer. But if we don't have a buyer in any form of healthcare activities, it's not going to go anywhere. So we need to have a buyer. The stakeholder, we're talking about the executive arm of the government, the legislative arm of the government, being involved, not just involved, but seeing healthcare service as a top priority. Because when I look at what is happening in the United Kingdom, the politics are there, people are playing politics, but you find out that in the midst of that politics, healthcare is also part of, like the National Health Services is top in the political agenda. Any government, if you've not said any substantial manifesto about the national health system, you are not going anywhere. And that is the priority we want to transform to the politics in Nigeria, because once the government is able to change that mindset, change the priority, and actually accord healthcare services a higher priority, it's going to make a little more influence in terms of what we're going to get into healthcare services, how much is going to be put in there, and even the funding, how it's being appropriated and all that. Then we move on to the politics in the healthcare space. So because we can't separate the two, the appointment of who is leading who and all that, they all come from the government. So the politics in healthcare space is one of the areas that, because of appointment of leaders, those leaders need to be the right kind of leaders to stay in those right kind of position. If we mismatch that, you find out that there's going to be, even if we have a lot of the funds, that's still going to go into mismanagement. So it's very important that we also identify there's a politics in the healthcare space. And that is in terms of leadership roles, who is doing what and all that. And a lot of time, one of the areas I find very interesting where we are is that most clinician healthcare professionals are encouraged to be involved in politics. So it's actually when you are at the table, you can actually determine what is going on at the table. But if most of the time the healthcare professionals are out there in the hospitals trying to save life, yes, we're meant to save life, but at the same time, we're also meant to be involved in politics, because if we have a lot of healthcare professionals involved in politics, they'll be able to speak out and say, you know what, we need to have this regarding healthcare system. But those are some of the areas that we have to actually encourage people to get more involved. The healthcare profession, doctors, nurses, pharmacists, they have to be involved in politics. Politics is not for a certain group of people, and is something that is used in the government. So we can use that, and we can use it to our benefit, because once we have more people in that space, they can speak on behalf of the healthcare system, and we'll be able to get more impact on that. Regarding the politics in the healthcare space, the appointment of leaders who is doing what in terms of the hospital setting, primary care, secondary care, and all that, that also needs to be looked at, because most often than not, we find out that those appointments are not more or less like, this is the best candidate for this appointment. And if you don't get the right person that has the right expertise and skills, you're just going to miss it out. So it's important that we also identify those ones that have the right skills to lead in those healthcare spaces. And the government will play their own part. We, as a healthcare profession, we also play our own part in our little space. And how do we do that? Clinicians are encouraged to get involved in management leadership role. It's not just about going into hospitals, seeing patients and all that. You can also take up some leadership roles, managers and all that. And at the same time, we can also recognize the importance of non-clinical managers in the healthcare space, because those people play a significant role in healthcare transformation. And that is that's also some of the models that we use in the United Kingdom. We have a lot of service managers that are not doctors, that are not nurses, that are just non-clinical managers, and they help to actually transform the health system, monitoring what is going on. So for us, politics, the larger perspective is the government, and then the healthcare, of course, we have to look into the healthcare space. And hopefully once we're able to get involved more, we can actually change the dynamics. Thank you.
Can I just add to that just briefly? So while I agree that politics is critical, and I, if we look at countries that we were similar to, decades ago, right? So if we look at the Asian tigers as an example, right, that clearly had 100-year strategies that they developed, curated, and invested in, right? And that's why they're playing way ahead of us today, on many levels. There's no question that we need leaders that are strategic, have the capability, are able to execute regardless of the pressure. But there are many of us in clinical and non-clinical areas that have no interest in politics and will never enter, such as me. I have no intentions of ever entering politics. So I do think that if we want to be able to make a dent and work in a multidisciplinary way, we do have to think about roads that others can essentially go on or embark on, journeys that they can embark on that will help us collectively. And I do want to underscore two things around that. One is that for those, I will say that honestly, when it comes to Nigerian healthcare leaders in the public space, in the private space, I have never met a more receptive group of people who have a huge thirst for knowledge, who care about quality in healthcare, who actually truly do want to make a difference. I really want to underscore that. I've had the privilege through partnerships with the Healthcare Leadership Academy of Africa of having trained a number of our government and private sector leaders in healthcare, and it's been my honor and privilege to do that. And I will say that they have such a thirst, right? But when you're working in an environment that doesn't really support you in achieving your dream, that burden, it really goes to kind of what's the quadruple aim. You're not able to achieve population health level outcomes if you're not and drive improvements in patient outcomes and reduce the cost of care or increase revenues if you don't have satisfaction in the healthcare leadership or the clinicians who are doing the work, right? So it also goes to Maslow's hierarchy of needs. How do we ensure the basic needs of our healthcare leaders are met so that they can effectively lead in the context of politics. How do they manage in political environments? The US, the UK, they're all managing in political environments. So what support structures can we give today to our healthcare leaders who want to make a difference, but don't necessarily have the support? I actually would say I feel like there's a number of private sector entities that are trying to do that more and more. The second piece that I want to highlight is actually the role of diaspora in funding agencies today and international NGOs. Or did I see you smiling? So I will say that, so I used to work in an international NGO before, to be frank, you know, the situation of my father, the reality, nothing had changed, and my frustration with development assistance as we saw it made me so enraged. And as my best friend in Tidibu Nelly always says, like, leverage your rage for change. And so for me, that's really what compelled me to do what I do today. And so what did I see? And I see it today, and I just really want to underscore this. There's a number of international funders or global funders and international NGOs that actually have the ear of the government more so than than we do, right? And they're able to influence, and they influence government policy, they influence government interventions, and it can be incredibly, that's where transformation can also happen, right? When millions and millions and millions of dollars that they're either directly funding or influencing government to allocate their existing budgets to areas that they care about, that's going to completely have an impact on our healthcare system. And increasingly, I've seen a number of diaspora in these NGOs or in these funding organizations, many of who understand what the issues are and are trying to influence in a positive way. But there are many who are, for whatever reason, maybe struggling with that a little bit. They're not able to effectively influence. They're talking about us in ways that one could question, a lot of you may have heard about the colonization of global health. So our own diaspora are actually contributing to this belief that Africa, is not necessarily where innovation can occur. It's not a place, Nigeria is not necessarily a place where innovation can occur. We are somehow less than. We're not equal when it comes to our counterparts. And so I just want to encourage and push, diaspora in those big NGOs or in those funding organizations. Again, we have some really amazing examples where that's not happening, but I've also seen many examples where it is, and it worries me because they are the ones that can directly influence government around healthcare, and we need to see a change. If they're not able to effectively leverage their positions of power in those NGOs, et cetera, to make a difference.
So Nneka and Chris, you guys have been powerful. Chris talked about government prioritizing healthcare and then, determining how leaders are being appointed. And that's really important if we're going to even begin to make a difference around how healthcare is being practiced and who's practicing and who's leveraging what, where the opportunities are coming. How the leaders being educated, I think, is sort of my own question, because if we say healthcare practitioners should be at the table, then, be at the table with what? If you feel like you're not skilled to do that, then you're almost at the table to be eaten for dinner, even though you think you have a fork and a knife in your hand. Somebody's actually holding cutlery over your head. So we can park that for a minute. But Chris, you made a really good point about the importance of government prioritizing healthcare and allowing the private sector to do what the private sector is doing. Keep in mind that government has to provide the enabling environment. So, and then how are leaders being appointed? Nneka has brought up a really important, two really important points. One is the satisfaction of the healthcare workers and leaders. How do we ensure that in the context in which they find themselves, they can provide the best of care because they have the necessary support structures to do so, and they can function in a way like many of us who, I remember my first 3 months in the US, I kept thinking, I can practice here. This will not be a problem because things were easy because I only needed to do what the doctor needed to do. I didn't have to worry about whether the mother could pay. I didn't have to worry about whether I didn't have to worry about anything except make sure the cannula goes into the head or the neck or wherever it is once, get the blood flowing, moving right along. I needed to be a clinician. In Nigeria, I had to be a carpenter, a fundraiser, an advocate, make sure that I had money in my pocket every time the mother needed a cannula to buy all of those things. How do we make sure that those systems, I'm smiling, you remember, how do we make sure that those systems work? But the other thing, and this is really critical, and I don't think it's meant to be a criticism, I think it's meant to rein us in. Because I too, like NECA, worked in the development space before returning, again, that frustration that we're doing this, we're not moving the needle. How do we ensure that we who have the ear of government are able to channel government's mind around doing the things that will make for change? How do we ensure that when we're speaking to people on the other side of the river, of the funding river, we are communicating that Nigeria is a place where you should invest that money in for technology, for innovation, for opportunities? How do we ensure? And the diaspora has a really critical role. And what we say and how we say it makes the difference. I can't tell you how many times people say, oh, if it's Nigeria, that one is not going to. Well, it's working in Nigeria. People are doing good work in Nigeria around interventional radiology. People are doing breast reconstruction surgery. People are doing all kinds of, every replacement you can think of. They're doing intraspinal surgery. People are doing this stuff. People are also identifying newborns who are blind and getting them into surgery in record time. We are doing these things. So what we need to do is get our conversation right also. And the diaspora has a really critical role to play. I feel like we overshot our time. And I just wanted to mention very quickly round the room. We've been talking about what can be done. And one of the things that I think we haven't spoken enough about, but we've mentioned it, is sort of the educating of leaders, the educating of healthcare professionals. We have issues around large classroom sizes. Then our doctors graduate and they can't find space for house job. And then they finish, they get house job and they can't get into residency. And then the brain drain took over. And now we can't even get enough of them into residency, even though we don't have paid positions for them. Then there's a concern that we're not building teams. So we always say we're educating doctors to be doctors in silos, separate from nurses, separate from pharmacists. And Chris has started to talk about the Diaspora Healthcare Agency and the Commission, and Aham has talked about educating doctors. How might we influence healthcare education? And I'm not just talking about doctors, I'm talking about building health teams very quickly to include having rounded people who come out like NECA, and they're doctors, but they can think like an engineer and they can work an Excel sheet like an MBA, because we put it all into the curriculum. Where are the opportunities? Can we pilot something? Can we, or should we even bother? Or is that part of the seismic shift we talked about? Quickly.
Yeah, I think education is very important, and we've touched on different areas. And one of the things that's happened over time is there's been a lot that's changed in terms of medical education and training. Over the last 20 years, there's a transformation, and we need to identify that in healthcare setting in Nigeria, because a lot of time we find out that the ways things are being done are still things that were done when I was in medical school. Not much has changed, or even worse than that. But things has moved on. We're in 21st century. There's a lot of things that has changed, and that starts right from medical school, nursing school, pharmacy, all the healthcare professionals. At that level of undergraduate, the curriculum has to change, and part of the curriculum change is the form that is not just about individual unique professional training. We are looking more of a multi-professional training. So when you're actually working as an undergraduate, you should be actually knowing that you're not going to just come out as a doctor and be working as a doctor, you're going to work with a multi-professional teams, and these are the role they will play in making sure that you deliver a high-quality care to your patients, and that is lacking. And those are the areas that we're actually looking at. How can we improve that? It's very important, and that's one of my area of passion. I'm very passionate about that, because if you look at having practiced in Nigeria, trained in Nigeria, practiced a little bit before going to the UK, the difference is just enormous. It's not about the knowledge. We've got the background knowledge, but delivering that high quality care to our patients, it doesn't even need a lot of funding, because we are looking at the low-hanging fruit. And the low-hanging fruit is actually changing our cultural practice. What we know, how we train doctors, nurses, pharmacists, laboratory scientists, so that we can work as a team, which is not practice. It's like everyone is working independently. A doctor will do a ward round, the nurse is doing her own thing and all that stuff. But you can't really work effectively as a team in such a way. And it's important that when we are talking about education, it's going to be more from undergraduate level to postgraduate level, and also training the people that are involved in training this group of people, because a lot of time you find out that people that are training them have already got their mindset about how to train. Oh, this is how I was taught. They're just transferring that. And that is why medical education is taking a prominent role in medical practice now, because a lot of people need to be retrained on how to actually train medical nursing students and all that. So those are some of the areas, because we need to train people so that they can work as a team. Also training in terms of soft skill, those are lacking in our curriculum. Nobody taught us how to communicate with patients, how to communicate with patient relatives, how to break bad news. Those things are not taught in the university. And you come into practice, and these are the things you see every day. You talk to your patient in a way that when you are done, the patient knows that, yes, even though I have this issue, I'm satisfied I've got this. So it's very important. These soft skills are not in our curriculum, and that has to be, we have to find a way of getting those into our curriculum. How do we do that? We have to be working more collaboratively with all the medical schools, the postgraduate schools, and because those are the groups that will actually help us to. Those are the groups that will help us to do the things that we need to do. Because if we involve the
I feel like we lost Chris, but I heard what he was saying, that we basically need to work with medical.
I can hear you.
Okay. 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 So
can you hear me?
Yes, we can hear you, Chris. We're going to need to wrap up now. I'm just going to ask Aham if he wanted to add something to what Chris said.
Well, certainly, I think Chris has fantastic ideas.
The knowledge in.
Chris,
go ahead.
Yeah, I'm sorry. I'll say that it seems that Chris had some fantastic ideas on educational training and how reforms are needed. And I think prior to that, Nick also had some fantastic ideas on supporting the NGO space, among other things that she mentioned. And already I agree with you that there's fantastic work being done. I'm very proud of the work we do at our own center at CAS, complex hip and knee revision surgeries, including those that had failed, spine surgeries, sports injuries and whatnot. But I think the problems that we are facing as a country go way beyond that at this point. And that's why I thought the idea of some political solution is where we need to start thinking. And I know we're not all politicians. I'm not a politician. I've never run for any political. I'm not a registered political member of any party. But I think more and more, as I've done work in Nigeria, it's like you start trying to see what is the root cause of the problem. And maybe that's from my surgical training, where we try to find the root cause of a problem and extract it. And as you take a deeper and deeper dive, okay, they're good ideas. Nigerians are not short of good ideas. In a few minutes, Chris just, spewed out a few. Nigerians have been putting out good ideas forever. But what is the obstacle? Who takes those good ideas and implements them and deploys them? The private sector has its limits. I think at some point, we need a government, as NECA said, is strategic, is futuristic, is Nigeria-centric in its planning and solutions, and then has the will of the people to carry us all along with that strategic plan. And in the absence and inability of us as a people to somehow get that done, we will continue to fall short, in my opinion. Just look at the 2021 budget, where the National House of Assembly has a budget of 130 billion, and the medical space as a whole has 380 billion. Currently, the spending that Nigeria has on healthcare is 200 times lower than what the UK spends. So if we think we want to catch up with the UK at the current rate, such that our president doesn't go to the UK but can stay in Nigeria, at the current rate, it will take us 200 years to catch up. So as a people, we have resources, and it's how do we share those resources? How do we distribute them? How do we use them to fix our problems? Again, it's not a shortage of ideas, it's not a shortage of skill, it's not a shortage of talent. I think it's a shortage of political will and ability to solve those problems. And so I can do what I can for the rest of my life in my own space, and I'll be applauded for doing great work, for taking care of thousands of patients, and will be hailed as somebody who figured it out in his own space. But if we're thinking of a country and how a country can turn around, then I think somehow it's political. We don't all have to be politicians. We can support the political solution without being a politician, and figure that out by thinking in that direction. So that's what I'm getting at.
Thank you very much, Aham. Neka, do you have last thoughts?
Yeah, I mean, so I also think, what we always tell our team members is, when I was in the university, I didn't have Google, right? And so I think we also need to look around what's happening in the rest of the continent too, right? So I agree with Aham. If you look at Rwanda, right, there is political will there. There's a lot of innovation happening there. We are hiring, there's universities that are partnering, American universities, et cetera, that are partnering and setting up satellite universities, and African universities actually as well, African Leadership University, setting up shop right in Rwanda. My company, MDoc, is hiring from Rwanda and has been for the last 2 years, right? So I think that, so I completely agree with Aham around this, on the sense that without that leadership from a government perspective, are we going to make seismic change? Probably not. But I do believe that at the private sector level, that if we essentially create a unit and say, look, we're going to make a unit of transformation. If we're going to invest in education, whether it's education or whatever else, we're going to set up university systems or there's new primary and secondary school education systems that are affordable for our low income population, to harness what they have internally, right? And give them the same opportunity so they can play and compete on the global field and allow us to be a new Nigeria. I think we can do that. There's so many examples across Africa happening today of that innovation. And so I just want to urge, there's a lot, and I think there are a lot on this in the audience today who are doing some of that. But I think the real question for me too is, could Apostles in the Marketplace as a platform help to convene us in terms of driving some unit of transformation? And I'm going to continue to go back to education. I have said consistently, we now recruit at MDoc for empathetic problem solvers. Before it was, okay, you had to have this clinical background, we realized, forget it. We can train that, because quite frankly, our training system has failed the folks today. So we know we're gonna have to retrain. But right now I need people who are empathetic, who care about the person and who will go to the very last mile. And to Chris's point, they have not been trained that in their education systems. They have not, and it has blown my mind. But quite frankly, I don't want to have to do that, because I don't want to have to work upstream and downstream, because I'm trying not to have a stroke at the age of 53, right? To be very honest, I am trying to have self-care for myself while I pursue transformation for my country. So what does that require? It requires us as a collective to define and agree on select areas in the health arena. Select, because we can't solve all the problems. Can we be somewhat narrow? Can we say, okay, education is where we're going to go, and we're going to go on the clinical education perspective, but we're also going to do some non-management, how to think critically, how to be a problem solver, how to communicate, how to actually write an email and write a sentence. And I'm not even joking, because that's where we are today. And actually speak correct English, because even though our own local languages are equivalent to English, to compete in the global space, you actually also have to be able to speak our official language of English. So how could we collectively say, look, these are the 3 elements we're going to invest in, leverage all the powerhouses working in the US, the UK, etc., to provide a conduit for them to train, to build capacity, for long-term transformation. But it's following a long-term strategy where there's governance and accountability, a measurement framework that holds us accountable, single-level leadership to drive this change in the private sector, working very collaboratively with our government. Can we do that today? That's kind of the question for me, but I think if we really do that more intentionally, we will see some level of change, while we hope the political arena will drive us even further into the narrative.
Thank you, Nneka. Thank you, Nneka.
Already you're on mute.
Sorry. Oh, I keep muting. I keep getting muted. Okay. Thank you, everyone. Thank you, Nneka, for that really great wrap up. That was a final, that was really good. So I heard from Dr. Chris, low hanging fruits, we got to change our cultural practices and our, the way we behave. Nneka, Aham has wrapped up and said private sector has its limits, and we've got to think about strategic, futuristic behavior from the government with people at the center. And Nneka has very well said, you know what, we can still make a dent if we select something and we focus in one area and we decide as a diaspora with AiMP as our convener to narrow on 1 or 2 areas, some clinical education, yes, but also the other things that make for a good clinician or practitioner, whether it's non-managerial skills, the things we refer to as soft skills, communication, writing an email, whatever it is that makes you a good, rounded human being in order for you to be able to provide this really all-important kind of service. And so if you translate that into very many people, then you'll be getting to the place where you have a transformed healthcare system. I want to thank Dr. Nneka Mobison, Dr. Aham Onyike, and Dr. Chris Agbo for being engaged, amazing panelists. Thank you for inadvertently answering all the questions that were being put up on the chats and on the Q&A. Aham, I see you answered a few of those. Thank you as well. Thank you very much to the organizers, to the AiMP network. We owe you a debt of gratitude for bringing us together, and we would like to take this forward by actually engaging and doing this one thing that will make a difference and will begin to transform the Nigerian healthcare system. Thank you again. Bye.
Thank you, Dr. Orede and everyone.
Thank you, everybody.
Thank you.
It's been a pleasure. Thank you.
To all our very distinguished panelists and, of course, Dr. Orede, thank you so much. It's been a deep dive. Clearly, all of the articulation there on the subject matter of not just in terms of health, but the political psyche of the health and family and repositioning it with the diaspora intervention from this conference and definitely from this conversation. Education, once again, has become the critical harnessing point for whatever it is that we want to articulate as an accelerator. So become a problem solver, learn to communicate effectively, create capacity vehicles, whatever it is, let's make it inclusive, sustainable, and productive for a more just economy for diasporas and all Nigerians engaging, and corporate strategic relationships and partnerships for Nigeria as a transformed nation. Once again, we'd like to appreciate everybody. And now, before we go any further, we're going to be taking a goodwill message, which will be followed by a video testimony. So a goodwill message by Professor Vincent Anibogu of the Institute of National Transformation. And if anyone is a personification of diaspora coming home to do what has been global, it has to be Professor Vincent Anibogu. Professor, you're on.
Thank you so much, Madam Dyer. And I want to appreciate the leadership of Apostle in the Marketplace for inviting me to be a part of this harnessing and accelerating the role of the diaspora in national transformation. When I heard that, it sounded like you want to increase people like me in Africa, and that sounds like music to me. My name is Vincent Anibogu. I'm the Director General of the Institute for National Transformation, and our vision is to raise value-based, no-excuse leaders in the 7 spheres of the society towards national transformation. As a result, we have training centers in different parts of Africa. I lived in the US for 20 years, for 30 years, 10 of which I spent studying chemistry, and 20 years I spent teaching and researching in analytical chemistry. But I was greatly burdened by the state of our continent, and especially our country, Nigeria. And so I left US in 2006 and came back to Nigeria to pursue that burden of raising value-based, no-excuse leaders across the 7 spheres of the society. I did that by establishing the Institute for National Transformation, and we currently have presence in many nations. I take special interest in this conference, this gathering, because I was once a diaspora. I once lived in the comfort of the United States of America, but I had to come back to see what I can do to contribute towards the development of our nation. And if I had not had an organization like the Apostle in the Marketplace, there's no way I would have succeeded in that mission that God sent me. The Apostles in the Marketplace received me, they nurtured me, they gave me the space, and encouraged me to do what God has invited me to do. So I especially want to thank the Apostles in the Marketplace, the leadership, for really encouraging diasporas not only to come back, but providing the platform for them to succeed. You know, the scripture says, talking about Jesus, he said, because of the joy that was set before him, he endured the cross. Why is it that many of us are leaving the comfort of America to come back to pursue our passion? The answer is, we believe in Nigeria. Like Abraham, we are all looking to that nation whose maker and builder is God. We are looking for that nation where everything works. And I believe, as the statistics have clearly shown, that the diaspora has the skills, the commitment, and everything it would take to build Nigeria. I just want to encourage those of us who have come to stay put, and encourage those who are abroad, who don't know whether they should or they should not. I want to encourage you to come. We all need to put our hands together in order to develop Nigeria. Thank you again, Pastor John, Dr. K.N. Elema, and all the leaders of the Apostle in the Marketplace. May the Lord truly bless you for the great work you have done, and especially for what you have done in my life. Thank you so much, and I wish all participants great participation, and I pray that you will learn quite a lot from this conference. Thank you so much, and God bless you again.